Hello, my name is Monica Amaya. I'm a nurse at Prairie View A&M, and I'm going to be doing your vital signs, okay? I'm going to perform hand hygiene. Okay, before we start, have you had any headaches?
No.
Any nausea?
No.
Any eye problems?
No.
Okay. Have you had any abdominal pain?
No.
Okay. So to start off, I'm going to do your blood pressure. So can I see that one? You could lay it flat. Okay. Okay, so your blood pressure was 121/80. Okay, now I'm going to be doing your pulse. So let's see one. Okay. Okay, so your respirations, your pulse was 70 and your respirations were 16. Okay, now I'm going to go ahead and take your temperature. Your temperature was 98.2. Okay, now we're going to be doing the neurologic part of the assessment. Can you please tell me your name?
Cassandra Batres.
And can you please tell me the day?
August 30, 2020.
Where are you right now?
My house.
Okay, so I see you are alert and awake to time, person, and place. I see that your posture is erect and relaxed. I see the color of your skin is throughout the body. I see your facial expression is coherent to the situation. And I see your consciousness is alert. And I see that you're well groomed and your hair is neatly done. Okay, so that'll be the end of this part of the assessment. Okay, now we're going to be doing the eye part of your exam. So for this part, I'm going to be seeing your external eye. Okay, so I see that your eyelashes are even. Your eyebrows are evenly distributed. I see that the color of your lids are evenly throughout. I don't see any swelling or lesions. Okay, now I'm going to be determining your pupillary reaction. So I'm going to be shining the light from the side of your face, okay? Okay, so I see that your pupillary reaction, they are directly and consensually bilaterally. Okay, that'll be it for this part of the assessment. Okay, now we're going to be doing the respiratory part of the exam, the posterior, and then I'm going to move on to the anterior, okay? So to start off, can you please move to the side so I can see you? Yeah, okay. So I see your spine is straight, your thorax is symmetric. I see your ribs slope at a 45-degree angle. Okay, now I'm going to be checking your chest expansion, so I'm going to be touching you. Breathe in. Okay. So I see your chest expansion is symmetric. Okay, now I'm going to be palpating for any masses, and if you feel pain, let me know, okay? I'm going to move your hair. Any pain? Any pain?
Mm.
Pain?
Mm.
Pain?
No.
Pain?
No.
Pain?
No.
Pain?
No.
Okay, so I didn't feel any masses or pain upon palpation. Okay, now I'm going to be listening to your lung sounds. When I tell you, breathe in. Breathe out. Take a deep breath. Okay, so I did see the vesicular sounds over the lung field, and I did not hear any adventitious sounds. Okay, so that'll be it for the posterior. Okay, now we're going to be doing your anterior thorax. Okay, so I see that your anterior thorax is symmetric. I see that there are no lesions, and your color is consistent throughout. Okay, I see that your ribs slope at a 90-degree angle downward. Okay, now I'm going to be checking your AP transverse diameter, so if you could please put your hands straight ahead. Thank you. Okay, you can put them down. I did see that your anterior posterior to transverse diameter was 1 to 2. Okay, now I'm going to go ahead and check your radial pulse. Okay, so I was actually checking your respirations, and I did see that they were 12 to 20 beats per minute, which is regular. I also saw that your breathing pattern was regular, and you were breathing effortlessly and automatic. Also, I did not see the use of any accessory muscles. Okay, now I'm going to be palpating for any pain. So if you do feel pain, let me know. Did you feel any pain? Okay. Now I'm going to be auscultating for your lung sounds, okay? Breathe in. Okay, so I did hear your vesicular breath sounds and they were clear, and I did not hear any adventurous sounds. Okay, and now we conclude the anterior part. Okay, now we're going to be doing the cardiovascular part of the assessment. Okay, so I'm going to be checking for your internal jugular. So if you could look that way. Okay, now you can look that way. Okay, so your internal jugular pulsation is present with the spine. Okay, now I'm going to be assessing your carotid pulse. Okay, now look that way. That. Okay, now can you look this way for me? Okay, so your carotid pulse is a 2+ bilaterally. Okay, now I'm going to be hearing for your S1 and your S2 and for any heart sounds. Okay, so I did hear that your S1 was loudest at the apex and your S2 was loudest at the base. I didn't hear any extra hard sounds or any murmurs, okay? And that'll be conclude the cardiovascular part of it. Okay, now we're going to be doing the abdomen part of the assessment. Can I please lift your shirt up? Okay, I see that your abdomen is flat. It's symmetric bilaterally. I see that your color is consistent throughout your body. I see your respiratory movement. I don't see any extra movements. I see that your umbilicus is midline and inverted. Okay, now I'm going to go ahead and auscultate for your bowel sounds. Okay, so I did hear your bowel sounds in all 4 quadrants. Now I'm going to be palpating lightly to feel any masses or tell me if you feel pain. Did you feel anything? Okay, so I did see that your abdomen is flat and there's no involuntary guarding. Now I'm going to be palpating deeply for any enlarged organs. Okay, so I did not feel any enlarged organs, and that'll be concluding the abdomen part of the assessment. Okay, now I'm going to go ahead and do the peripheral part of the exam. We're going to start off with your arms and we're going to move down to the legs. Okay, so I'm going to inspect the sides of your arms. I see that they are equal size bilaterally. Now I'm going to touch for if there's any edema. So can I see your arms? Your other arm. Okay, so I see there's no presence of edema. Okay, I see that your color is consistent with your ethnicity. Now I'm going to touch your arms for the temperature. Okay, I see that your temperature, your skin is warm to the touch. Okay, now I'm gonna be accessing your hands to see for any clubbing on your nail beds. So if you could put your hands like this for me. Okay. I see that there is no clubbing present and your nail bed angle is less than 160 degrees. Okay, you can put your hands up. Okay, now I'm going to be checking your capillary refill time. Can I see your finger? Okay, so your capillary refill time is less than 3 seconds bilaterally. Okay, now I'm going to be checking your radial pulse. Your other hand. Okay, so I do see that your radial pulse is a 2+ bilaterally. Okay, and I'll be concluding the arm part of you. Okay, now we're going to be doing the peripheral part of the leg exam. Okay, so now I'm going to inspect your legs. I see that your color, the leg color, is consistent with your ethnicity. I see that your hair is evenly distributed. I don't see any lesions present. Okay, now I'm going to go ahead and palpate your legs to feel for any presence of edema. Okay, so I did not see any edema present. Now I'm going to go ahead and touch to access your temperature. Okay, so I did see that your legs are warm to the touch. Okay, now I'm going to go ahead and assess your capillary refill time. Okay, so I do see that your capillary refill time is less than 3 seconds bilaterally. Okay, now I'm going to go ahead and access your dorsalis pedis pulse. Okay, so your dorsalis pedis pulse is a 2+ bilaterally. Now I'm going to go ahead and access your posterior tibial pulse. Okay, so I did see that your posterior tibial pulse is a 2+ bilaterally. Okay, and that'll be the end for this part.